Welcome to our exploration of a fascinating medical question. Can asthma medications potentially treat food allergies? Asthma, a chronic condition that affects the airways and the lungs, and food allergies, adverse reactions to certain foods, are both immune system responses. However, they manifest in different ways and are typically treated with different medications. Asthma is characterized by inflammation and narrowing of the airways, leading to symptoms such as wheezing, shortness of breath, chest tightness, and coughing. On the other hand, food allergies involve an overreaction of the immune system to proteins in certain foods, resulting in symptoms ranging from mild, such as hives or itching, to severe, such as anaphylaxis, a life-threatening reaction that requires immediate medical attention. Despite these differences, both conditions involve the immune system and inflammation, raising the intriguing possibility of overlap in treatment strategies. In this film, we'll delve into this topic, examining the latest research and hearing from experts in the field. We'll also discuss the potential implications of this approach for patients living with these conditions. So, could asthma medications hold the key to treating food allergies? What is asthma? Asthma is a chronic respiratory condition that affects millions of people worldwide. It's characterized by inflammation and narrowing of the airways in the lungs, leading to episodes of wheezing, shortness of breath, chest tightness, and coughing. These symptoms can vary in severity and frequency from person to person, and they can be triggered by a variety of factors such as allergens, exercise, cold air, and stress. The exact cause of asthma is unknown, but it's believed to be a combination of genetic and environmental factors. Some people may be genetically predisposed to developing asthma, while certain environmental factors such as exposure to allergens or viral infections in early childhood may also play a role. Asthma is typically managed with a combination of medications and lifestyle modifications. Medications include quick relief inhalers to treat symptoms during an asthma attack, and long-term control medications to reduce inflammation and prevent symptoms. Lifestyle modifications may involve avoiding triggers, following a healthy diet, and maintaining regular physical activity. Despite these treatments, asthma remains a significant health concern, with many patients experiencing uncontrolled symptoms that can lead to emergency room visits and hospitalizations. This highlights the need for new treatment strategies and approaches. What are food allergies? Food allergies are immune system reactions that occur soon after eating a certain food. Even a tiny amount of the allergy-causing food can trigger signs and symptoms such as digestive problems, hives, or swollen airways. In some people, a food allergy can cause severe symptoms or even a life-threatening reaction known as anaphylaxis. Food allergies are estimated to affect 4% to 6% of children and 4% of adults. They are more common in children, but adults can also develop food allergies, sometimes to foods they've eaten without a problem for years. Food allergies are usually triggered by 8 foods: milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish. However, any food can cause an allergic reaction. The immune response to food allergens involves the production of specific antibodies, which bind to cells in the body and cause them to release inflammatory substances such as histamine. This leads to the symptoms of the allergic reaction. Diagnosis of food allergies can be challenging, as symptoms can vary widely and are often similar to those of other conditions. In recent years, there have been exciting developments in the field of allergy and asthma treatment. The U.S. Food and Drug Administration, FDA, has approved certain asthma medications for the treatment of food allergies. This groundbreaking decision is based on extensive research and clinical trials demonstrating the effectiveness of these medications in reducing allergic reactions to food. The FDA's approval process is rigorous and thorough, ensuring that all approved medications are safe and effective for their intended use. This process involves a review of preclinical and clinical data, including information on the drug's pharmacology, toxicology, and manufacturing. The approval of asthma medications for food allergy treatment represents a significant advancement in allergy care. It opens up new possibilities for managing food allergies, which can be life-threatening and significantly impact quality of life. However, it's important to note that while these medications have been approved by the FDA, they should only be used under the guidance of a healthcare professional. Patients should not attempt to treat their food allergies with asthma medications without first consulting their doctor. This development raises many questions. How do these medications work in treating food allergies? What are the potential benefits and risks? What does this mean for patients with both asthma and food allergies? How does it work? The intersection of asthma and food allergies is a complex one, involving intricate mechanisms of the immune system. Asthma medications, specifically those that control inflammation and relax airways, are now being explored for their potential in treating food allergies. The underlying principle is that these medications can reduce the immune system's overreaction to food allergens, similar to how they decrease the immune response causing asthma symptoms. They work by targeting certain cells and chemicals in the immune system that contribute to inflammatory responses. For instance, some asthma medications work by relaxing the muscles around the airways, making it easier to breathe. This same mechanism could potentially alleviate an allergic reaction by preventing the airways from constricting in response to an allergen. Other asthma medications reduce inflammation in the airways by inhibiting the action of immune cells like leukotrienes, which are involved in the body's inflammatory response. Similarly, these medications could potentially reduce the inflammation caused by an allergic reaction to food. It's important to note that while the theory is promising, more research is needed to fully understand how these medications can be used to treat food allergies. The safety and efficacy of this approach also need to be confirmed through rigorous clinical trials. The potential use of asthma medications for treating food allergies could have significant implications for patients. For those living with both conditions, this could mean a streamlined treatment approach, potentially reducing the number of medications they need to manage their symptoms. For patients with food allergies who have not found effective treatment, this could provide a new avenue for relief. It could potentially reduce the severity of allergic reactions, improving their quality of life. However, it's important to remember that this is a new area of research. While the initial results are promising, more studies are needed to confirm these findings and to understand the long-term effects of this treatment approach. Patients should not change their treatment regimen without consulting their healthcare provider. It's crucial to have these discussions with a healthcare professional who can provide guidance based on the latest research and the patient's individual health situation.